Hi, I'm Dr. Deeptee Jain, and I'm a spine surgeon. I treat thousands of patients every single month. Another question that I get asked very frequently is, what is a herniated disc, and does it need surgery? So let's start with the first question. What's a herniated disc? In our spine, and I have a model of the spine right here, we have vertebra, and in between these bony vertebrae are what's called discs. So that disc can degenerate, and that disc has an annulus that's super tough and then a jelly-like substance inside. That's called the nucleus. And so that jelly-like substance can squish out. It can pop like a pimple, and it can go into the spinal canal. And when that jelly-like substance enters the spinal canal, our spinal canal is a constrained space, and there's lots of nerves in the spinal canal. So that substance, that disc, can actually push on a nerve, and that can cause really severe pain. That's very disabling. So the second part, does a disc herniation always need surgery? Absolutely not. A disc herniation is not a sentence for surgery. In fact, there's a great article in the New England Journal of Medicine, which is this world-renowned medical journal, where they take an MRI of a patient, and then they take an MRI of a patient somewhere down the line, and you can actually see that that disc herniation can resorb, okay? And the symptoms can go away. So whether or not that disc herniation actually resorbs on the MRI, actually, believe it or not, is irrelevant. What's relevant is that usually the pain goes away. So the majority of the time, more likely than not, the pain goes away with non-operative interventions. And what are those non-operative interventions? Those can be things like medications, physical therapy, different kinds of injections. So what are those different types of non-operative care treatment strategies? These can include things like physical therapy, medications, and different kinds of injections. One, both, two, or all three of them can improve the disc herniation pain or the leg pain such that eventually the symptoms go away and the patient no longer elects to have an operation. I'm Dr. Deeptee Jain, and if you like what you're hearing, hit the like button and also subscribe, and you'll get lots of great information on neck and back pain.